Hi, good evening. So this is Dr. Ho again, and tonight's presentation is going to be about type 1 diabetes. So I had a few presentations recently on type 2 diabetes. Now, you might wonder, what is the difference between type 1 and type 2? Well, it's very, very basic. In type 1 diabetes, it's a autoimmune disease. In other words, the body's own defenses are making antibodies and they're attacking basically some very special cells in the pancreas that make insulin. Now, if you remember watching in the type 2 diabetes and prediabetes videos, insulin is the key that allows the sugar to get burned up in the muscles. And so, as far as food interventions, as far as type 1 diabetes go, I didn't really go too much in depth in my preparation for tonight's talk on that because essentially the same healthy diet that is very beneficial for folks with type 2 diabetes can be very helpful for type 1 diabetes as well. And especially if they are keeping an eye for monitoring their blood sugars and insulin. So one of the main differences between type 2 and type 1 is that in type 1 diabetes, it usually onsets in childhood. Now, the onset of type 1 diabetes has actually been growing in the last few years, I believe about 3% per year, actually, for one of my references. And the tragedy is that once a child develops these antibodies against its own insulin, against its own pancreas that's making the insulin, more specifically, then there's really right now no cure for it other than to replace the insulin that the pancreas is no longer able to make. And if they do not have this insulin, then somebody with type 1 diabetes very much could die in a relatively short time. This is one of the reasons why I was so thrilled to find out when they created these wonderful insulin monitoring pumps, which has been a great lifesaver for many people with type 1 diabetes to improve their blood sugar control. Because these new machines, basically, they go underneath the skin, they constantly check the amount of sugar that's in the blood, and that automatically doses some insulin based on what it sees. So it's actually pretty nifty and pretty amazing, and has been quite life-altering for a lot of my patients with type 1 diabetes. So why would a plant-based diet or something close to it be very beneficial with folks with type 1 diabetes as well? Well, you might remember in the type 2 videos, I spoke about the main things that were problems for folks with type 2 diabetes. Guess what? It's the same problems that happen with type 1 diabetes. Leading cause of blindness, huge cause of kidney failure, and problems with the feet. Also, a much higher risk for heart disease and heart attack. Intense or very well done control of the blood sugars throughout the entire lifetime of someone with type 1 diabetes really has a significant impact on the death from heart disease. One of the statistics that I found was that folks who have type 1 diabetes on average have a lifespan that's about 10 years shorter than folks that do not have it. And one of the main reasons for that is because of the basically the problems with the death from or disability from heart disease, kidney disease, and the like. And as a matter of fact, intense and very good control of the sugars over the course of a lifetime can reduce the risk of a type 1 diabetic getting heart disease by 50%, kidney problems by about 39%, eye problems by about 76%, and reduces the amount of nerve damage by about 60%. And over the course of my lifetime, I have had the chance to take care of some type 1 diabetics. I had a gentleman who was a very, very well-controlled diabetic, and then he had a twin brother who was a very uncontrolled type 1 diabetic. And the one who was basically had taken good care of himself over the many years, in addition to being very regimented and careful and mindful of the amount of sugars and carbohydrates and the amount of insulin and making sure that everything was balanced in a good way. he basically was pretty much normal. I mean, there was hardly any indication that he was diabetic other than the fact that he had to do the insulin. Whereas with the brother, they had already started getting cataracts in the eyes, which is one of the ways in which it can cause blindness, and also gastroparesis. So again, the let's see if got it backwards on my page so I could look at further. And so basically, again, that stomach paralysis or gastroparesis, that is much more common in folks with type 1 diabetes that do not take good control of themselves and do not take care of their diabetes. Because as the nerves throughout the body essentially get damaged, the ones that are most notably damaged and can cause problems are in the chest, so that people have a much higher rate of silent heart disease. They have a heart attack and they don't even know it because the nerves, they don't get that crushing chest pain, for example, sometimes. And the nerves to the feet and the nerves to the stomach get paralyzed, and that leaves a lot of discomfort, a lot of burping, a lot of feeling full all the time, but not really being able to eat and so forth. So I have definitely seen it both personally as well as in the literature about the impacts of just diet lifestyle on folks with the type 1 diabetes as well. So please, if you haven't seen it recently, check out the presentation that I made on the consequences and goals for diabetes as well, because really the complications are essentially the same for both type 1 and type 2 diabetes. So if type 1 diabetes is an autoimmune disease and it's rising in this country along with many of our other autoimmune diseases, what might that be accounted for? It's not that our genes are changing this fast. A lot of it has to do with our modern diet and how inflammatory it tends to be, or triggering it tends to be. So some examples of this, there seems to be a strong correlation between type 1 diabetes and the exposure to cow milk or dairy milk early in life. And there was an interesting exception to that rule. Apparently, there were some cows in Iceland that the herds in Iceland had been isolated from the rest of Europe for, I don't know, 10,000 years, a very, very long time, whatever it is exactly. And they had been separated from the other herds for such a long time that their amounts of proteins in their milk were actually changed in such a way that it was a little bit less likely to trigger the type 1 diabetes. Now, that is a little interesting factoid. I'm not actually recommending everybody go out and get Icelandic milk to give to their kids instead of dairy, because of all the other hormones. A cow that's pregnant and that is lactating is still going to be giving you guys a lot of extra hormones, regardless of whether it's an Icelandic, organic, American, European, any kind of cow. It's still a mammal that is going to have female hormones in the milk. At any rate, so it's gotten to the point where apparently the American Academy of Pediatrics no longer suggests dairy for the infants. They usually recommend breastfeeding as much as possible. And so they were saying that the early cow's milk exposure, like in childhood or infancy, definitely increased the risk of type 1 diabetes by about 50%. And there was some interesting stuff about the antibodies. So whenever we take in some food, it's digested by the stomach and broken apart by the intestines. And in a very, very, very young infant, that intestinal barrier, the ability of the body to keep some stuff on one side of the barrier and some stuff, going through, it's very, what we call permeable. It's kind of loose. It doesn't really have as good of a barrier on it. And so what they were finding was there was a correlation between the children, who were talking about cow's milk. Yes, I see that from Raj. Hi, Raj. So basically, the children who were exposed were starting to get antibodies against the insulin that's present in the cow milk. And again, as I was mentioning before, you got a pregnant cow, you're going to get pregnancy hormones, which is one of the main reasons why when I have somebody with a lot of acne and I tell them step away from the dairy, step away from the cheese, and the milk and all that. And they very, very often experience a dramatic clearing up of the skin. Well, there's actual insulin that's also present in that cow milk. There's also usually some pus, usually some other components that would normally be going into a calf if it was available to the cow. So anyway, so there seems to be some correlation. They are working very hard to really nail down the specifics, but the overreaching theory is that basically when these very young infants are exposed to it, the cow's milk protein kind of filters through from the intestine into these Peyer's patches, which are right next to it. Now, what the heck is a Peyer's patch? Well, right next to the intestines, so imagine all those squiggly intestines down there, there are these immune system patches or groups of cells that sit right next to the intestines, and they're called Peyer's patches. It's one of the ways in which we have a very close immune system relationship with the food that we're eating. And this leaky gut phenomenon that I mentioned with the babies seems to be related to other autoimmune diseases potentially as well. And we'll probably go into that a little bit more in depth later as well. You can put a link to it below in case anyone was interested in learning a little bit more about that immediately. So anyway, so the idea is that as the body gets sensitive to the cow's milk insulin, then it starts getting antibodies against the cow hormone. Well, it may get a little bit confused with, oh, well, look in the body. This is the area in the body that seems to be having a lot of this insulin stuff. It must be bad. Let's start attacking it. Is essentially the short version, simplified, much, much simplified, of what the theories, what they're looking into for potentially the link between dairy and the type 1 diabetes. So, of course, there is some genetic risk with type 1 or type 2. People are born with a certain set of genes, but the amazing thing is that the genes don't necessarily always have to express. Even if a identical twin to somebody else has it, same exact genes, the other twin only gets the disease about half the time. If it was a perfect, genetic link, you would expect that the other twin would have it like 100% of the time or something, but that reflects that there's a lot of environmental and a lot of other potential factors that can play a role in the development of type 1 diabetes as well. And this one is an interesting study as well. So basically there was some children in Japan, and it was noticed that the children in Japan have much lower rates of type 1 diabetes than the children in the United States. Again, lots of environmental food and other factors that go into this. And then they took the immigrants and they studied, all right, well, what happens if we take these group of children from a country that historically is very relatively low in type 1 diabetes, and look at what happens to the children that moved from the Eastern environment to the Western environment, get exposed to all of our lovely junk food and everything else that goes along with being in this country. And lo and behold, they saw that the rates of type 1 diabetes in those children from Japan were actually rising to meet the rate of the diabetes of the children that live here. So so not a part of America that we really want to be exporting, so to say. So also, if a few other things, just to do a quick survey of some other things that tend to raise the risk of developing type 1 diabetes. There seems to be a very close family member of, if there's a first-degree family member, a mother, father, brother, sister that has type 1 diabetes, and then the risk is about 10 to 15% greater for the other members of the family compared to the general population. So again, if you're identical twins, your DNA matches exactly. About half of the time the other twin is going to get it. And if you just have a family member with type 1 diabetes, then it's maybe about a 10-ish, 15% chance of getting it. Another theory that's been proposed out there is that there seems to be a link between childhood Coxsackie virus and other GI viruses and the risk for developing type 1 diabetes as well. And there's a good chance that, just as I spoke about with some other things, where that permeability of that intestinal lining seems to be compromised when we have these GI bugs, it's entirely possible that maybe those proteins are kind of getting across, or perhaps there's something else in relationship to the GI bugs that tend to increase the rates of type 1 diabetes. A few other things that go along with it. If the child is larger, 4,500 grams at birth, higher risk of the diabetes. If the mother has preeclampsia, so again, as the mother takes good care of her health, it can directly impact the future risk of the child. So taking steps to control the blood pressure and to have a good, healthy diet during pregnancy can greatly reduce the risk of the children developing type 1 diabetes. If the mother is over age 25, which it seems like many mothers are starting a little bit older these days, which is okay. You can go through college, go through some things to start up life sometimes, or people tend to be a little more stable when they have birth a little bit older, so it's one of those risk benefits. I would not go starting a family at like age 18 or something only to prevent type 1 diabetes. It's just overall risk factors. If the baby gets a lot of jaundice from an ABO incompatibility, so what does that mean? So basically, if the child is born with a blood type that's different from the mother, sometimes the mom starts making antibodies against that alternate blood type. And so basically when the baby's born, it's kind of saddled with some of these blood cells that are breaking down a little bit, and they can get jaundiced from it. It's one of the reasons we give women RhoGAM, to prevent such problems from happening for future babies. Let's see, women who feed by breast milk for the first year of life, not necessarily exclusively, but incorporating the breast milk, it tends to have a protective factor against type 1 diabetes. And then this is another interesting link as well. So the idea was to wait until the baby is over 3 months old to start any kind of cereals that are gluten containing, and also before 7 months old. So they're finding that there is a really interesting narrow window. So no gluten containing cereals before 3 months, and then there was this magic window between 3 and 7 months where the risk for developing type 1 diabetes later in life seemed to be minimal. And then if the cereals are introduced after 7 months of age, then again that risk seemed to go up. So there seems to be a magic window of waiting between 3 and 7 months to start any foods or cereals that contain gluten. And last but not least, vitamin D drops during infancy, which is pretty widely recommended now that the children have enough vitamin D from day one to go through life. There's a lot of studies on the link between vitamin D and immune system diseases. So, of course, lots of other lifestyle factors, moving away from the risk factors for developing it. And that's a little bit of a laundry list. The main thing that we can impact on all of that really is the things that are food-related or lifestyle-related. Other lifestyle factors that can play a huge role in the life and the longevity and the quality of life for a person with type 1 diabetes really goes back to the fundamentals of lifestyle medicine in general. So taking very good control of your blood pressure, good control of the cholesterol, avoiding tobacco, and exercising. Those 4 things can go a huge, huge way in mitigating any problems from the type 1 diabetes as well. And so thank you for joining me on this wonderful tour of type 1 diabetes. And just want to leave you with a thought on the role of identity and type 1 diabetes as well. Back a few weeks ago, I did a couple of talks where I was just kind of exploring the role of identity in medicine and how sometimes it can pose a barrier to to health, or it sometimes can basically enhance one's ability to cope with whatever is going on. Because I've noticed that as I was going through my residency, some of the times the people that had the most trouble with the type 1 diabetes were not necessarily the folks who are in their 20s or 30s or 40s. Those people, usually they kind of got it and they were really on it or on board with the diagnosis and what to do to take care of themselves, and usually know more about it than anybody else in the room, kind of thing. And then you had the children that were going from the age where they might have been diagnosed at age 8 or 9, and for a while mom and dad were kind of controlling them. Okay, you can only have this much carb and here's this much insulin, and the control was pretty much on the parents. And then when the child had to start to internalize that and basically start to become responsible for their own carbohydrates, there was a very common phenomenon of rebelling, because those teenage years are so fundamental to the formation of identity. And if you're kind of fighting back against whatever family environment you're in, a very easy way of trying to regain that sense of independence and control was to basically kind of wreak havoc with the blood sugars. So anyway, it's just one of those little pieces of food for thought as far as when people take on the identity of the illness. Sometimes if it's done with a sense of, I guess I'd say, thank you, freedom and responsibility. Yes, if it's done with a sense of responsibility and saying, all right, well, the body has this condition. I should do these different things to take care of this vessel, the body that I'm in, and that way I will eventually, over the long course of life, I could do my best to basically go through life healthy. Versus thinking, all right, well, I'm just going to go ahead and do whatever I want. I'm going to have a piece of cake. I'm not going to worry about the insulin. That sort of thing. We had a few children that were repeat, people that had to go into the hospital and be, hospitalized, almost comatose from their sugars being so far out of whack, high or low, usually high in these cases. And so that's kind of a tough thing for somebody to have to go through and adapt to and stuff. And so if you know anybody with type 1 diabetes, have a big grain of compassion for them, because it's a tough illness to have to live with. It's a kind of a burden that they have in a sense, because they essentially are given this thing with shortened life expectancy and other things that could happen to them over the course of life, and they have to basically go ahead and get ready for whatever they're taking care of. And on top of that, they've got to make sure their insulin's working okay, make sure the pump's all right, or if they have a pump, or be very regimented or very disciplined and usually taking care of the rest of things. So anyway, hopefully this was helpful for y'all, and I will be talking about another topic to be decided next week. And if you have any particular thoughts or any questions that you would like to be answered in an upcoming talk, you can either write the questions below this one, or let me know via another route, and I'll consider it as being one of the things for the next week. All right, have a good night. Thank you for watching. Bye-bye.